Employees at the VA are sounding the alarm. They say they are concerned about work conditions and how the VA is handling COVID-19. They plan on protesting tomorrow morning, but first, they talk with the I-Team's Vanessa Murphy.
27 employees have tested positive for COVID-19 at the VA Southern Nevada healthcare system, according to a spokesman.
We've had a number of issues where protocol's been blown, and we've exposed people to it.
While the VA says many of the cases were from community spread, this group of union leaders and representatives for AFGE Local 1224 aren't convinced.
Can you talk about how that conclusion was reached?
Many of the staff of those 27 are not involved in any direct patient care whatsoever.
William Karen is the medical director. While these employees bring up several concerns, he calls this facility one of the safest places in the city.
You can't get onto this campus or into a building without having your temperature taken. Everyone is wearing a mask, the universal masking. We have the PPE access, utilization, the aggressive cleaning and sanitation, the contact tracing, the multimodal communication that we put out there.
Any concerns about protocol not being followed and putting patients at risk?
No, at this point, we've not seen any evidence of that.
Employees describe PPE being reused. Karen says while there was some initial confusion about the handling of masks, it was addressed and masks are reused only if they're in good condition to preserve the supply. Another concern, testing. Employees say they believe the VA should test workers who may have been exposed to the virus. Karen says testing is mainly limited to workers with confirmed exposure and symptoms. Telework is also an issue. Linda Ward-Smith is the AFGE Local 1224 president.
We have elderly people who have conditions. They have high blood pressure, they have all these things, and they're still coming to work. That's a concern for me. And because their managers are still allowing them to come to work knowing that they have these conditions when they could telework, concerning to me.
Karen says out of 2,800 employees, 800 are deemed eligible to work from home and 450 are doing so. He admits there was a hurdle with technology.
On the initial rollout, I remember the Citrix platform was a challenge for some people. And obviously, if you don't have the technology to work, then we would ask you to come back on campus.
Union workers also point to a lack of communication from higher ups. While Karen says he's been transparent from the start. In March, the first known case of COVID-19 in Nevada was treated at the VA hospital in North Las Vegas.
How quickly was your staff notified that a COVID patient is in the hospital?
Well, the staff that were in direct patient care obviously were in the loop right away. But within that 24-hour time span, I had done a direct email to staff and we held 2 town halls.
2 different views of what is unfolding at the VA Southern Nevada healthcare system.
While I'm disappointed in the few staff members that may feel slighted, we are following CDC guidelines and guidance from above, and we're communicating that on a regular basis.
Stating, oh, we have no issues, everything's fine. We have enough PPE, we have enough telework, all those things. They're lies, and it's time to expose a lie.
Some of those union members work in a separate office building. They say they were not notified about a positive COVID-19 fellow employee. William Karen says he is not in charge of that building. We reached out to the VA for a response, did not hear back by deadline. Vanessa Murphy, 8 News Now.
Vanessa, thank you. The union planning on protesting tomorrow morning at 6:20 outside the North Las Vegas VA Medical Center on 215 and Pecos.